My name is Jonathan Miller. I'm an emergency physician from Erie, Pennsylvania, and I've been coming to Sabaneta de Yasaca in the Dominican Republic for the past 10 years. About 5 years ago, I met Richard Taylor.
I'm Richard Taylor in Sabaneta on the north coast of the Dominican Republic. Last week in March of 2012, we had a group of doctors, mostly from Pennsylvania, that came just for one day. They came and they saw 100 patients one day.
We generally come down here with the goal of treating as many patients as we can in multiple neighborhoods, very poor areas here around Sabaneta. Richard was helping us as a translator 5 years ago, and Richard has a huge heart for the poor. And it wasn't long before Richard had become friends with many of the Haitians in the area, who are certainly the poorest of the poor here, even in the Dominican, where everybody is poor. Shortly thereafter, Richard had bought a piece of land and was building nice concrete block houses with concrete flooring, and pulled multiple families out of little tin shacks with dirt flooring, greatly improving their lifestyle and their position in life. And he started sending emails out about the work he was doing, and it was exciting work that was easy for my wife and I to be excited about, knowing Richard, knowing his heart for the people, and knowing how they live and how much he was improving their life. So we began donating money every year. We usually give about $4,000 or $5,000 each April. And with some of that money, Richard has managed to buy more land and now has a church and a soup kitchen and a clinic. And up until the last few months, the clinic had been going well, but had run out of funding in the last few months, so has been sitting vacant, not seeing any patients. Yesterday, we were able to staff the clinic for one day and saw a lot of sick patients. The people we're seeing, they have no work, they have no money, they have no food other than what Richard's able to give them at lunchtime each day in the soup kitchen. And Richard's main work right now is to get funding to get the clinic reopened. And there's great need there. The people are living in mud puddles and there's parasites everywhere. It's appalling. Most people couldn't imagine the conditions they're living in. So we were there for one day, just one day, and there's enough patients there for 365 days.
It's really important for our community to have this group of doctors come and share their talents and share their medicine, and because we've had a clinic there for the last couple of years, but in the last 4 or 5 months we've been suspended for lack of medicines and lack of a doctor. When we first started our clinic a couple of years ago, we had a doctor, Dr. Margaret Alberg, with us working full-time, and the clinic saw on an average of 350 patients a month, and we gave away thousands of dollars worth of medicine, and it became a real center of medical care for the Haitian refugees in our neighborhood, because Dr. Margaret is a Haitian and she speaks English and French and Creole and Spanish, and she could really be a better physician to our Haitian population than the Dominican doctors. She understands the community's needs and the people's needs better than anybody else could, really. The people were happy to see us operating again, and basically it costs about $20,000 a year for us to operate this clinic, and at the moment we're seeking funding for our clinic, and hopefully we can provide our medical services again. We have a conversation going with another Haitian doctor lady who I hope will join us as soon as we can find funding.
My name is Kristen Long. I'm a physician assistant. I work at a big teaching hospital. In this community in particular, there's a very dramatic difference in the poverty level as a whole. Mother Teresa has been someone that I've wanted to emulate my whole life with her work with the poor. There's a quote from her, and at the end of it, it says, "Life is life, fight for it." The people of this community take that to heart, and they're fighting for their lives every day. And I think that's something that we can take as a lesson as well, and that each and every life here matters, just like each and every life back in the United States matters, and we should be fighting not only for the lives back home, but for these lives here, because they are people too. They deserve to be loved, and they deserve to have the same advantages that we do. I had the opportunity to come to the health clinic here, and it was only open for one day, and that day was the most emotionally challenging for me, as there was one family, and the father's name was Willie. His daughter is 1 year old, and his son is 8 or 9 years old, and he recently lost his wife. They lost their mother 2 months ago to HIV. When he started telling me his symptoms and what was wrong with him, I got a sinking sensation in my stomach that he was going to test HIV positive as well. It's extremely heartbreaking to know that down here they don't have the access to the medications that people in the United States or other countries have. And at this time, HIV is something that people can live a long time with if they can get proper medications. And to know that those two beautiful children may one day be without a father as well was really hard for me. In that day, we saw 100 plus people, and to think that if you can see that many people or more in one day, what can you do with the next day and the next day and the next day? Every little bit helps. Time, money, talents. I think it's important that we that have been blessed with so much use what we can to bless others.
All right, we're all rolling.
March 14th.